And I think that one of the things that bugged me about as we, 2020, obviously there was an increase in excess mortality because COVID was there. Then you have the mass introduction of mRNA vaccines in 2021, and you would think that there would be a reduction in excess mortality, and there just wasn't. In the places that had really high mRNA introduction, you did not see a decline in all-cause mortality, and you still had persistent excess mortality in many of these places. And I think it's absolutely right. It goes back to the tunnel vision of like a Fauci only caring about like this one infection. You have a vax that maybe reduces that. If it's increasing other ways, then you're not any better off if that's the case. And it was almost like you couldn't even talk in those terms, when this thing was first introduced. Tracy had mentioned what was going on in California. Good rule of thumb for us in Florida, whatever they do, we do the opposite. And so we are actually going to be moving through the legislature this year, in the upcoming legislative session in the spring, a bill that actually protects physicians' First Amendment rights, and it protects their right to dissent from orthodoxy and from the establishment. And Joe and I endorsed this bill last year. It didn't quite get across the finish line, but I'm confident with our new leadership it will. And this is just something where, pediatrician should be able to say that kids don't need to be wearing masks without fear of reprisal just because some of the higher-ups are bent on imposing this on people. Same thing with these mRNA shots. All the stuff that we've seen, most of the people who got it right were in the minority when it came to some of the professional opinions, or at least the outwardly spoken minority. There may have been a lot of people that just weren't willing to speak out and were quietly dissenting from Fauciism, but of the people that were willing to speak out, they were a minority at the time on all these issues, and yet they've been proven right. So we look forward to being able to sign that into law. Our first announcement, it kind of comes from some of the stuff we've heard with silencing of opinions. I think a lot of unethical behavior by some of the medical association and establishment. Of course, when you have something like mRNA and these companies have made a fortune off this, federal government imposing or at least attempting to impose mandates, and a lot of false statements that were made over the last year and a half, almost 2 years, saying that it would end COVID, saying you won't get infected, telling people, young people, that you need to get it so you protect your elderly parents, minimizing any discussion of any type of adverse impacts when it comes to mRNA shots. And so you've seen a lot of this, and I think people want the truth, and I think people want accountability. So you need to have a thorough investigation into what's happened with these shots. We also need ways to get more data so that we can better evaluate what actually happened. And the fact of the matter is we lack comprehensive patient-level data from the pharmaceutical industry, and that makes it very difficult for independent researchers to check the integrity of these shots that have been so pushed on America and Florida. It is against the law to mislead and to misrepresent, particularly when you're talking about the efficacy of a drug. We see just recently, Florida got $3.2 billion through legal action against those responsible for the opioid crisis. And so it's not like this is something that's unprecedented. So today, I'm announcing a petition with the Supreme Court of Florida to impanel a statewide grand jury to investigate any and all wrongdoing in Florida with respect to COVID-19 vaccines. And we anticipate that we will get the approval for that. That will be something that will be impaneled, most likely in the Tampa Bay area, and that will come with legal processes that will be able to get more information and to bring legal accountability for those who committed misconduct. The second announcement I'll let Joe Ladapo go a little bit more in detail on, but we want to build off the work he's done by increasing surveillance and research of adverse impacts from the COVID-19 shots.
Really no other virus in recent history has become so politicized as COVID-19. I mean, you've found yourself, we've talked about this many times, at the center of some of that angry debate. Elon Musk just came at you and attacked you. But the latest now, Dr. Fauci, is Florida Governor Ron DeSantis. He's now asking the Florida Supreme Court to greenlight an investigation into, and the way he put it, is any and all wrongdoing in Florida with respect to COVID-19 vaccines. What's your reaction to that?
I don't have a clue, Kate, what he's asking for. I mean, we have a vaccine that unequivocally is highly effective and safe and has saved literally millions of lives. The Commonwealth Fund has come out with a report just this past week that vaccinations that have been administered over this period of time, this last year and a half to 2 years, has saved 3.2 million lives, 18 million hospitalizations, and approximately $1 trillion in costs. So what's the problem with vaccines? I mean, vaccines are life-saving. So quite frankly, Kate, I'm not sure what they're trying to do down there.
It kind of gets at a bigger issue I've been wanting to ask you as in one of our final interviews in your role in public health is just the one result of the pandemic has sadly been that science has become a divisive topic, politicized and weaponized by some people. Have you thought about how do you pull that back? How do you turn that around?
You know, Kate, if I had an easy answer, I'd give it to you, but it's a very difficult situation. You're absolutely correct. It has been politicized, and it has been politicized in a way that has actually caused lives, because if people don't get vaccinated, which unequivocally is life-saving because of political ideology or because of misinformation and disinformation, that causes lives, and we've just got to get the American public, regardless of whether you lean left, you lean right, it doesn't matter at all. We're all in this together. We're all human beings, and we're all susceptible to disease that can kill us. So if ever there was a time in society when we need to pull together and recognize that the common enemy is the virus, not each other, we've got to get people to appreciate that. You know, like I said, I don't have an easy answer how we're going to do that. But when people's lives are being lost about this, maybe that'll shake people up enough to realize that we've got to start pulling together and not against each other.